Good morning, folks. My name is Michael Scott, and I am the program manager at the Center for Black Health and Equity. This morning, we'll be talking about a topic that's been gaining a lot of traction over the past couple of years, and that is the banning of menthol and other flavored tobacco products. However, before we start, please note the following disclaimers. The views, thoughts, and opinions reflected in this presentation and/or accompanying handouts belong solely to the presenter, myself, and do not necessarily reflect the official views, policies, or positions of CADCA. Also, the term tobacco used in this presentation refers to the use of commercial tobacco only and does not reflect the traditional use of tobacco by American Indian nations, which honor the creator and is governed by cultural protocol for spiritual, ceremonial, and cultural uses. Now, some of you may be more familiar with the older name of the organization which I represent. You may be more familiar with the name NAPTN, or the National African American Tobacco Prevention Network. While our name has changed, our mission has not. Our mission is still to facilitate the implementation and promotion of comprehensive policies, community-led programs, and culturally competent public health campaigns that benefit African Americans. In recent years, our focus has expanded beyond tobacco to include HIV/AIDS, COVID-19, diabetes, and just a general focus on overall health equity. We felt it was time to change the name of the organization to reflect this broader focus. Now, the name NAPTN still remains as one of the programs under the Center for Black Health and Equity umbrella. Here at the center, along with CADCA, we are members of the CDC's Networking to Save consortium of organizations. And this is a network of organizations that are charged with advancing the prevention of commercial tobacco use and cancer in populations experiencing more tobacco and cancer-related health disparities than the general population. Now, one of the center's top priorities since its inception as NAPTN, over 20 years ago, has been protecting the health of the African American community from the scourge of menthol flavored cigarettes. While menthol flavored cigarettes have been on our radar for at least the past 20 years, again, over the last few years, we've seen how menthol, along with other flavors, have impacted the use of tobacco products, particularly with the popularity of e-cigarettes among our nation's youth. We do know that banning menthol and other flavors of tobacco products, including e-cigarettes, will have a positive impact on the public's health, as well as decrease the number of current smokers and reduce the number of new smokers. We've also seen in the last few years a marked increase in jurisdictions across the country who have successfully passed and implemented menthol and/or other flavor bans. Passing such restrictions is not easy and not without opposition. As more and more locales are looking into menthol and flavor bans, today I'd like to take you through a presentation discussing some of the whys and the hows when it comes to understanding the importance of menthol and flavor bans and the positive impact that they can have on our community. Now, we're going to have time for question and answers after the slideshow. So please feel free to jot down your questions. And I look forward to a lively live in-person discussion after the slideshow. Excuse me. Now, the objectives for today's session are as follows. I want you all to be able to identify a minimum of 3 examples of how the tobacco industry targets African Americans and other priority populations with menthol and other flavored tobacco products. I'd like to leave with an understanding of the importance of using pro-health messaging to counter Big Tobacco's campaign against flavor bans. And then also be able to identify and understand some of the steps in building community coalitions or support for menthol and flavored tobacco bans in your community or in other communities. So at the end of all this, if folks are interested in how to move the needle in their specific communities around menthol and flavor bans, please feel free to reach out, because we have trainings that will also really dig a little deeper than we'll get into in this presentation. This presentation, I'll just go over some brief highlights. But here at the center, we also offer really in-depth trainings and presentations on menthol, on coalition building, on the history of African Americans in tobacco use. And I'll be glad to discuss that in more detail during the question and answer session. Now, as far as preventable causes of death, tobacco use was, still continues to be the #1 preventable cause of death in the United States, more so than alcohol use, gun violence, HIV and AIDS, suicide combined. Tobacco use still the #1 cause of preventable deaths. And then when we talk about tobacco use and smoking rates, we know that tobacco smoking rates, cigarette smoking rates, have been on the decline for decades, at least regular flavored cigarettes. Although this slide is a bit dated, it shows the steady decrease in the use of non-mentholated cigarettes, while at the same time showing menthol use remaining steady and actually increasing slightly. Now, this increase in menthol use is probably even more pronounced currently when we take into account, menthol and mint flavored e-products that are currently being used, and combine that with menthol cigarettes. We would definitely see a larger increase in the use of menthol flavored products in this graph. Now, many jurisdictions have already implemented flavor restrictions, with the exception of menthol. So as a result, what we're seeing is, folks that can no longer get their flavor of the day because their jurisdiction actually banned flavors, but did not ban menthol. Now they're choosing menthol or mint as a replacement for the flavored products that are no longer available to them. So this is why when we talk about menthol or different flavor bans, it's important that we include menthol and all flavors together, not separate. Menthol is a flavor, and any discussion of flavor bans needs to be comprehensive and include menthol, as well as all the other thousands of fruity, delicious flavors that are available to folks. Now, this image is interesting to me. It's an image of different flavored tobacco products, but this center image, Smoke Smart, the image is kind of blurry, but what that is a store. It's an actual tobacco retailer that I came across here in North Carolina, the eastern part of North Carolina, as a matter of fact. Now, as a public health professional working in tobacco prevention, seeing a retailer called Smoke Smart really just, really got to me. And I can only shake my head as I saw it, as if there's a smarter way to smoke. Now, for those of you who are unfamiliar with Eastern North Carolina, Eastern North Carolina is a rural part of the state. Its residents lack many of the resources available in more urban areas of the state. And notably, there's large minority populations, military populations, and the folks out in Eastern North Carolina um, tend to have a lower socioeconomic status, lower education levels compared to some of the urban city centers. So, it's an area of North Carolina that could use, more resources, more education around health and whatnot. Now, the town where I took this picture is considered a military town. There's an Army base, an Air Force base nearby. And I just couldn't believe the number of tobacco retailers in this small little town. As I passed through this town, every few blocks, it seemed, there was a tobacco retailer. And you can imagine the advertising. It was all flavored e-products, menthol cigarettes, just everywhere. And there was even stores, more than one, that had drive-throughs. So you don't even have to exit your vehicle to get your flavored tobacco products anymore. You can just drive up, order it, and be on your way. And then, of course, again, all of them were advertising flavored products, with menthol cigarettes leading the way as far as cigarette ads. Now, I bring up North Carolina, Eastern North Carolina specifically, and it being a military town and lacking resources, really to emphasize how tobacco use, specifically flavored tobacco products, menthol tobacco products, are impacting, specific populations. Now, the number of retailers in this small town really exemplifies how minorities, military personnel, rural residents are unfairly targeted, and how their communities are just inundated with menthol and other flavored tobacco retailers. Now, this unfair targeting of vulnerable communities is why, as an organization, the center has been focusing on menthol flavored tobacco for years, especially on its negative impact within the African American community. Now, we know that 9 out of 10 African American smokers use a menthol flavored product. We also know that African Americans suffer disproportionately from smoking related illnesses. Black folks actually start smoking later in life and smoke less per day than the average smoking population, yet they suffer worse consequences, including sickness and death. So in essence, African Americans smoke less, but die more. Now, I'd like to note that while my presentation may emphasize menthol and African American communities, we do realize that other flavors matter, and comprehensive flavor bans need to include menthol and other flavored tobacco products. So while I may specify menthol and say menthol more often, please realize that the importance of banning all flavored tobacco products and is what the presentation is about. But I may sound like I'm talking more about menthol, but I am referring to all flavored tobacco products. And just as menthol overwhelmingly impacts African Americans, other flavors have had devastating impacts as well, particularly on youth. So we know that 4 out of 5 young folks from the ages 18 to 24 who have ever used tobacco, they report that their first product was a flavored product. We also know that flavors actually motivate individuals to start using e-products, e-cigarettes, even if they were, never a traditional or combustible tobacco user. So these flavored e-products have introduced a new generation of, tobacco users Many of whom have never smoked a combustible in their life started using tobacco products because of the appeal that those flavors bring. Not to mention the fact that once folks start using these e-products and become addicted, and the nicotine addiction comes into play, some folks even begin using combustible cigarettes, or co-using combustibles and electronic cigarettes, all initially because they were attracted by the flavors. Now, again, as I mentioned, smoking rates are steadily declining. This image shows, a really swift decline in, adult smoking rates. But again, it's not the same for menthol. Menthol use is on the rise. And what we need to realize is that, while almost all African Americans use a menthol flavored product, when we look at other populations, we see higher rates of menthol use as well. So menthol use is not just a consideration or concern for the African American community. When we look at Asian Americans, the Latinx population, the LGBTQ community, all of these groups also show increased usage of mentholated products. And then if we break it down even further, we can see higher uses of menthol within some of the subgroups of some of these populations. And just for an example, the Latinx population, Puerto Rican smokers smoke menthols at about the same rate as African Americans. So, close to 90%. So somewhere in the 80 to 90% range. Now, the main reason behind this disproportionate use of menthol and other flavors in specific populations really boils down to targeted marketing. The tobacco industry has mastered this art, the art of marketing its deadly product to specific segments of the population. So anyone who's worked in tobacco prevention knows that Big Tobacco's marketing strategy and their marketing budget literally preys on the most vulnerable folks in our population. And this is a quote that I use quite frequently, and it contains a swear word, but I'll cut that out. So a tobacco industry executive actually said this: "We don't smoke that stuff. We just reserve the right to sell it to the young, the poor, the Black, and the stupid." Now, let me take a second here to correct the crass use of the word stupid, and assume that this executive was referring to folks with lower levels of education. So what we have here is Big Tobacco admitting that young folks, poor folks, Black folks, folks with lower education, these are the people that they're focusing on. These are the people that they want addicted to their product. Now, there's also, we can add to this group as well. We can add the homeless population. We can add the LGBT community, those that suffer from mental illness and substance abuse issues. These populations as well, underserved and experience greater stressors in everyday life. Yet, they are also they have increased rates of tobacco use, and Big Tobacco, takes advantage of this and markets these products specifically to these folks. Now, when it comes to African Americans, the pushing of menthol in Black communities is well documented. Now, again, please feel free to contact me about trainings regarding African Americans and tobacco use. We have trainings available from the center that really dig much deeper than I have time to in this presentation. In this presentation, I'll just skim over a lot of stuff, but more detailed trainings on this are available. So the The targeting of the African-American community has been systematic and intentional, no doubt about it. From increased numbers of mentholated tobacco ads in Black communities and media outlets to actual financial support from big tobacco provided to African-American events, political leaders. Big tobacco has utilized its $1 million marketing machine to actually make itself appear to be an ally to the Black community, to the LGBT community, to many communities. But, we know that that's not the case. Although they've infiltrated the Black community via the targeted advertising, supporting cultural events, even providing free samples, back when that was allowed, we know that they're not an ally, and these mentholated products are not what we need or what we want in any of our communities. And they've done the same thing with other flavored products. When we look at flavored little cigars, not only are menthol flavored cigarettes used more by African Americans, but so are these little cigarettes, these Swisher Sweets, these Black and Milds. They're also preferred more by African American smokers. And these flavored cigars and cigarillos come in dozens and dozens of different fruity and candy flavors. Similar to what we see in the more recent e-products, these e-cigarettes. Now, of the hundreds of flavor offerings for electronic devices, we definitely know that plays a role in how youth are attracted to these products and why they use them. This graphic specifically shows that 68% of high school students, who reported using e-products, used a flavored e-product, which was a 7% increase from the year before. And this is just another example of, flavored tobacco products showing an increase in usage. Again, regular cigarette smoking, downhill. Flavored products, steadily increasing. Now, similar to menthol products and African Americans, these flavored e-products are specifically being targeted to youthful audiences. The marketing behind gaining youth appeal definitely takes advantage of current trends in technology. Of course, we're going to see some ads in retail stores, but aside from that, most young people report seeing e-cigarette ads on the internet. In the retail environment, oftentimes we'll see, walls of colorful flavored products, a lot of times very close to and sometimes right next to candy and gum displays. Sometimes it's hard to tell, which is which. So, not only are youth seeing these products in retail stores, but again, the internet, social media specifically, social media influencers play a big role in these products. Now, social media influencers are, these are folks that they've garnered a certain amount of fame online. They have large groups of followers. Oftentimes, they're in the folks in their peer groups. So it's teenagers or young adults, and companies actually pay these folks to promote their products, on their social media outlets, which in turn is basically, it's advertising. It's free, not free advertising because they're paying these individuals, but it's the new commercial is to pay these influencers who have, again, that's what they're called, influencers. They influence the behavior of their fans and the people that follow them. Advertising has also included, Hollywood actors using the different e-products, oftentimes promoting them as cessation aids, or even utilizing similar messaging from past combustible tobacco ads You can see these ads right here. They've got Hollywood actors, influencers, modeled after tobacco ads from years past. You know, Elsewhere on the internet, we're going to see hundreds of videos devoted to vaping contests, product reviews, how to create your own flavors. You know, the list goes on. The use of social media influencers and the offering of over 15,000 different flavors, is what draws youth to use e-cigarettes. And we can't forget that once the in crowd and the flavors have convinced someone to try this e-product, to try this e-cigarette, now they've been introduced to nicotine. So now the nicotine addiction comes into play. Once addicted to nicotine, some e-cigarette users have even reported starting to use or co-use combustible cigarettes as well, which is another reason why flavors need to be banned. As far back as 2012, even, the Surgeon General's report mentions menthol and other flavors and identifies them as attracting new and younger smokers and disproportionately impacting communities, including African Americans. But yet, and still, we still have plenty of opposition to comprehensive menthol and other flavored tobacco bans. When discussing opposing points of views concerning the banning of menthol and other flavors, I like to be able to counter with pro-health messages. I think that education around the positive impacts of menthol and flavored tobacco bans is extremely important. And one of my heroes in this fight is Dr. Phil Gardner. I've learned so much from him, and had the pleasure to work with him quite a bit over the past few years. And it's hard for me to talk about menthol and African American communities, without quoting some of his many impactful statements. So, Dr. Phil refers to menthol cigarettes as an unequal opportunity killer. He calls menthol the ingredient that helps the poison go down. All the other poisons in cigarettes, menthol makes it easier to swallow those down. Now, the work he's done and many more tobacco prevention folks have done over the years has resulted in over 300 jurisdictions, already having passed some form of menthol or flavored tobacco ban. But there's still a lot of work to do. And being that menthol bans, really impact the African American community more so than others, we see a lot of pushback, citing the negative impacts such policies could have and how it's not fair to focus on, the type of cigarettes that Black folks smoke. But we want to be able to address that. And provide the reasons why. Again, 300 jurisdictions have already done so, and the FDA is actually being sued for not doing more. Now, this is an actual quote from an African American pastor, and this was during a town hall discussion regarding a menthol flavor ban, and he said that it's racist to ban the cigarette that most Black people smoke. If other folks can get their hookah and cigarettes, so should Black people. Now, I can't get on board with that. What we have to be able to do is provide factual rebuttals in response to claims like that, and really frame them as pro-health messages. So banning menthol and other flavors needs to be seen as a social justice issue, and treated as such. We should not be arguing against the removal of a product from the community that's killing folks. Saying that, if other folks can die, we should be able to die too, just doesn't make a whole lot of sense. And, opposition talking points, will also mention things like black markets, unfair police practices that are going to target African Americans, specifically African American young men. Big Tobacco even had Reverend Al Sharpton, hold town hall meetings across the country in the past few years, discussing how banning menthol would give police more reasons to harass black men in particular. But as hundreds of policies have been passed, we've yet to document any truly egregious examples of any of this happening. So there's no increase in black markets. There's no gang violence arising because of the banning of the sale of menthol. We just haven't seen it. But what we do know is that there's absolutely nothing unfair about saving lives. Now, if menthol had been banned in 2009, when flavored cigarettes were banned as part of the Family Smoking Prevention and Tobacco Control Act, we can see projected numbers of lives that could have been saved over the ensuing 40 years. So this chart reflects, how many lives could have been saved if, there was a 10% decrease in smoking, or if there was a 20% decrease in smoking, or a 30% decrease in smoking. So we can see the hundreds of thousands of lives that could have been saved by banning menthol. As we know, banning menthol, many folks report that they would just quit, or they would try to quit. So we know that, banning menthol overall is going to have a positive impact on the public's health. Now, as far as police interactions, comprehensive menthol and flavor bans are really centered on the sale of the product, not the use of or possession of. So, that argument kind of goes out the drain. Now, any discussion of a menthol ban in any community definitely needs to include enforcement, cessation, plans that are beneficial to the community. Enforcement should never fall on the police. That's definitely, should not be ever considered as part of any type of flavor or menthol ban. Public health officials are an example of folks that may be able to provide enforcement or education. But of course, we never want to include, any type of, arresting or, becoming involved in the criminal justice system because of the possession or use of a menthol or flavored tobacco product. Now, the last thing we want there to happen because of the menthol flavored ban is anything negative. So, we want to avoid negative consequences at all costs. However, there are some things that are unavoidable. Losing the ability to sell menthol cigarettes will definitely impact finances on a few levels. State and local governments are going to lose tax dollars initially. Small mom and pop shops, they may lose a portion of their sales. But while the loss of tax dollars, will be seen immediately, it's important to realize and to emphasize the long-term savings that states and locales will see as a result of no longer selling menthol and flavored tobacco products. So we're talking less healthcare costs, less pollution. We're talking decreased lost productivity. Plus it takes time to move away. It's time to move away from states and local budgets being dependent on taxes from a product that is literally killing its residents. Now the impact on small businesses is always a hot topic and not as easily answered. And I'd love to hear some possible suggestions, during the Q&A, in regards to, how can small businesses that may, rely heavily on income from these products, what can be done to assist these, businesses and replacing some of that lost income. Again, that's a question that, I've heard before and don't have a solid answer yet, but I would love to hear some feedback on that during the question and answer. So, again, when we talk about banning menthol and other flavored tobacco products, there's going to be some opposition. And what I would like to do now is just go through some steps to talk about how to build community support around menthol bans, flavor bans. And really, this can be used in for any type of community engagement. But the one thing that we know about menthol bans, flavor bans, you really need the support of the community behind you. Any type of policy change should really start with the community and include the community in all aspects. So the next few slides are going to take us through the importance of community support when educating around policy change. Given the current political climate, community engagement, community support needs to be as authentic as possible. And many times that includes addressing racism or any other form of discrimination that may be present and form a roadblock to progress. It's imperative, it's important that all parties involved be aware of their own biases, and recognize all aspects of the community, especially parts that they may not be familiar with. Recognize marginalized communities exist within marginalized communities, and they deserve to be heard as well. For example, the homeless population, any subgroup within another population, folks that have substance abuse issues, those folks are, we've got, Black folks, white folks, but within those, overarching groups, there's also, subgroups of folks that are being impacted, doubly because they fall under, more than one of the vulnerable population categories. Other concerns that communities are going to face, especially, again, in the current times, racism, civil unrest, poverty, chronic disease, violence. So it's really important to meet the community where they are and acknowledge some of these other issues. Not that, anything needs to be, put on a scale and what's more important than the other, but just to realize that, there are other issues that people are facing that may not seem as important to them as it is to folks in public health, and just being mindful of that. So, with that in mind, menthol and other flavor restrictions, again, need to be framed as a social justice issue, just as the other issues are, but tobacco use has become so commonplace, it's often viewed as more of a personal bad habit than, a public health nuisance, But, acknowledging, other community stressors is important. However, helping folks realize that, the injustice around menthol and flavors can be just as important and can be addressed in tandem with other issues, So it's not that something has to be left or, not addressed. Bring it all together, address it at the same time if possible. And engage the community whenever possible and as early as possible. And this really, truly shows partnership. So showing support at community events, community gatherings, attending or holding community meetings to educate folks. This is important when we look at menthol and flavor bans. As we've seen, Big Tobacco will attempt to co-opt community leaders, providing them with, misleading information, false information that once it's relayed via them to their community, it's really hard to counteract, you know, what community members have heard from people in their community that they consider, you know, leaders, and that they look for advice and, you know, doing the right thing in their community. Now, we also want to be able to share the process with the community, you know, allow decision making to include community representatives. The community needs to feel empowered. They need to assist in the creation of materials, resources, what have you. You know, we need to really demonstrate a willingness to be guided by what the community wants, not just what, you know, we in public health or policymakers want. In addition to engaging the community, you know, engaging it in movements and campaigns can be a strategic activity as well. And, you know, this can help garner support, get the word out to larger audiences. Again, for example, the center, you know, the Center for Black Health and Equity, we promote No Menthol Sunday every year, you know, as a way to educate communities around the negative impacts and practices around menthol flavored tobacco in the African American community. You know, and this is an easy way for communities to get involved in the fight against menthol and other flavors. And I'll talk a little bit more about No Menthol Sunday shortly, as well as addressing some of step 9 and engaging during COVID-19. So the last step we'll talk about is, you know, leaving the community stronger. You know, you want to leave the community in a space where they're stronger. In the case of the menthol ban, leaving them healthier. You know, so if possible, you want to allocate resources that are going to be left with the community. And that doesn't necessarily mean monetary. You know, for example, if a community is interested in how a menthol ban can happen in their city or town, you know, assisting with the creation or the formation of a coalition that is going to deal with this, that's going to get to the root of the problem and really build up the support within the community. You know, once, you know, the issue is you know, taken care of, whichever way it goes, you know, that coalition can remain as part of the community. You know, and then tackle issues, you know, other issues that come up, but as a community coalition. So that's, you know, just an example of a resource other than, you know, a monetary resource. And so I do want to have plenty of time for the question and answer, but before that, I want to speak a little bit about No Menthol Sunday. This slide actually lists some of the resources offered by the center. And please feel free to ask about these other resources during the question and answer period. But as we're talking about the importance of menthol and other flavored tobacco restrictions and bans, I'd like to emphasize No Menthol Sunday. You know, this is a yearly observance day created by the center over 6 years ago. This year will be our 7th consecutive year promoting No Menthol Sunday. And going back to step 9, you know, engaging during COVID-19. Last year, as a result of COVID-19, we had to switch, we had to pivot to make the event completely digital. And surprisingly, it was more successful than we had initially thought it would be. So utilizing technology, you know, during COVID-19 is the way to go as far as engaging communities with the lack of travel, the lack of in-person meetings. So we do know that No Menthol Sunday is gaining some traction. And, you know, being that we had to do it digitally last year, we utilized more digital resources. We utilized social media more. And one of the things that we've always done is provide a toolkit. So we made this toolkit, it's downloadable. And the No Menthol Sunday Toolkit provides participants with everything needed to facilitate a No Menthol Sunday event. Um, it serves as as an excellent way to educate communities around the dangers of menthol and the positive impacts that a ban would have. The toolkit includes things including fact sheets, sample sermons, social media hashtags you can use, just everything to really educate the community about menthol and flavor bans. So please feel free to contact me with any questions or training requests. Um, so now I'd like to transition into the live Q&A session of the presentation. I will show my contact information. Again, please feel free to reach out to me with any further questions or training requests. And I look forward to a lively and engaging question and answer session. Thank you very much. Because I cannot see folks, I'm not sure. Okay, perfect, perfect, perfect. And you guys can hear me as well? I can see in the chat that you all are muted, but you can hear me. Okay, okay, not a problem, not a problem. Thank you for attending this presentation. I have been monitoring the question and answer box. So I do see a few questions in there that I will answer. I was gonna type them in, but I figured I'd just go ahead and talk about them. So one of the first questions was regarding the training and where is that available. If you go to our website, centerforblackhealth.org, you will see a list of our trainings. And just to give you a little more detail on the trainings, we have a really in-depth training for folks that are interested in working with African Americans in tobacco prevention, specifically around menthol. We have a couple of different trainings. We have a really intense training. We have just a brief, 1 hour webinar training, and we can, massage it to fit the needs of your organization. So folks can feel free to reach out to me. I'll leave my email address, and we can arrange something. Right now, of course, everything is virtual. Hopefully in the next few months, we'll go back to being able to offer in-person trainings. I kind of missed traveling, so I'm looking forward to getting back into the swing of things. Another question revolved around, why is menthol and flavors, more addictive, or, people are quicker to become addicted than regular tobacco. Specifically with menthol, we're talking about the menthol's ability to kind of, simmer down the harshness of the tobacco, making it easier to smoke, making it easier to inhale more tar, more carcinogens, more nicotine. And another thing about smokers, and this is both menthol and non-menthol smokers, the longer you smoke, the more you acquire the nicotine receptors that grab hold of that nicotine. So the longer you smoke, the more of those receptors your body creates. So now you're able to, get more nicotine. Now, when we look at menthol cigarettes, there's an even higher increase of the creation of those receptors. So menthol smokers have more nicotine receptors, therefore a stronger addiction to menthol. And in the presentation, I may have skimmed over it, but menthol does a few things biologically, when you inhale it, when you use it. So it opens up your lungs a little bit more. It opens up the transbuccal glands in your mouth specifically, and this is for chewing tobacco and combustible tobacco. So now your saliva is flowing, your receptors in your mouth are more open because of the menthol. More open, to bigger entryway for the carcinogens, bigger entryway for the nicotine, for the addictive component of it. And that's true mainly for menthol. For flavors, it doesn't have that same biological effect. But with the flavors, you still get that same, covering up of the harshness, and the flavors themselves are what entices a lot of people to start using, specifically the electronic products more so than combustibles. But even so, the flavors are what attracts people, especially youth. So it's not that the flavor really makes it more addictive, but it's an incentive. I mean, it tastes good, it smells good, and people like that. So it encourages them, it increases their likelihood to use it. And then once that flavor, you love the flavor, but at the same time you're ingesting that nicotine, and before you know it, you become addicted. um and there was a question regarding why menthol, why not all cigarettes, which in the perfect world, the perfect end game, all cigarettes off the market would be awesome. But we've seen what the fight looks like, and maybe this is just baby steps. Maybe a menthol ban will lead to the next ban, which will cover all cigarettes. So we've got to look at it as a battle in the war. Now we do know that menthol is the starter product. So if we get that starter product off the market, that's a lot of people that are not going to even ever initiate tobacco use. And then being that my organization is a health justice organization focused on the health of the African American community. That's why our focus is so much on menthol. But we do know that other folks are using menthol, young folks are using menthol, and we can't forget other flavors. But specifically when we look at menthol, it is a flavor, and it's time that we include menthol in with all the other flavors. Other flavored cigarettes have been banned for 10 years now. Why not menthol? Menthol should have been in that ban originally. So I hope that answers the question. If not, feel free to reach out to me. We can discuss that further. And there was a question regarding the toolkit. So the No Menthol Sunday toolkit will be available in the next couple of weeks. The 2021 toolkit has not been created yet. Last year's may still be available on our website, but there will be a new one this year. And let's see. Someone asked about a cost-benefit analysis of a flavor ban, which is an awesome question, because that is one of the main counterpoints to a ban. Is there's going to be a heck of a loss of income from these taxes. And I kind of addressed that in the presentation as well. But as far as a cost benefit analysis, I don't have one that I can put my hands on right now. But the state of Massachusetts, someone mentioned in the comments, yes, they did pass a menthol ban. And when I spoke with them a few months ago, I asked the same question: have y'all seen anything yet? And they hadn't seen anything, damaging right then and there. But we do know that there's going to be a decline in the income from those taxes. What is that? ASH may have a cost analysis, or the Public Health Law Center. But that's definitely something that we're looking to include in our resources, because that's it's a question that comes up, and comes up often, and it needs to be answered. And you need to have at least a partial answer to that question when you're building that community support, and when you're talking in front of decision makers. That's going to be a question that comes up. But also, the other side of that is, at the end of the day, you're going to save so much more money then you're going to lose. Now, it may be a few years down the line, but we know that with, the decrease in, smoking initiation, the decrease in pollution, the decrease in healthcare costs, all that is going to far outshine, what's lost from tax revenue. And I've got another question. Let's see. Since we know that individuals, particularly individuals of color, often use substances to cope with historical trauma, discrimination, and devastating life circumstances, there is a concern that taking away a coping tool without first putting into place wellness supports to heal the trauma would increase suicide and mental health challenges. Yes, so very good point. And that's why when we talk about, any type of, menthol ban or flavor ban, we also talk about what needs to come along with it. So along with any type of ban for a community, you need to include in the discussions from the start what you're going to do to deal with, these other issues. So a flavor ban needs to include increased cessation, increased offerings of cessation services. And then also, this person mentioned a coping tool, and, that's one of the major crutches that people use, tobacco for is, that stress relief, even though the reality of it is it causes more stress to your body. That release of dopamine temporarily makes everything seem all right. But in the long run, it's causing much more stress to your body. So when you talk about flavor bans, that is part of the planning process, is including, cessation services, including, discussions about enforcement and how, law enforcement should not be, part of the discussion for, any type of menthol or flavor ban. Another question is, what does the menthol use rates look like between 2010 and 2020 compared to regular tobacco? And again, very similar to what the slides showed. You have about 80 to 90% menthol use among African Americans, and then among just the general public, menthol use hovers from that time frame probably right around 20 to 30%, probably closer to 30% for regular versus mentholated, and that's overall. Let's see, as marijuana legalization environment seems to be following a similar pattern of big tobacco in the past when it comes to targeting specific populations to use the product with flavors. Yeah. Is there anything community coalitions can do right now to prepare for these targeted marketing tactics? Yeah, that's a good point. Marijuana is following, big tobacco's game plan. And as far as like preparing for the targeted marketing tactics, I think that what communities can do is really follow the same thing that you would do with, flavored tobacco, menthol. You've got to get the support of the community. You've got to get the support of the, the decision makers in the community, and also be able to show that, menthol and flavors are specifically targeting these audiences, whether it's African Americans, whether it's youth, big tobacco, big marijuana, are using flavors as enticement for new users. So I think preparing coalitions, preparing them around tobacco and flavored tobacco initially, and then including flavored marijuana in that education will be beneficial. But being that, the whole marijuana thing it's still in the infancy stages, and we haven't dabbled in the marijuana stuff yet, but we know it's coming because it's legal here, it's legal there.
So it's only a matter of time before, we will have to really deal with this like we're dealing with menthol and other flavors. Another good question regarding banning big tobacco from decision-making tables and lobbying. That definitely would challenge their power, and that would be awesome. I think anyone involved in public health feels the same way. Big tobacco should not be able to lobby. I mean, other industries aren't able to lobby, and I think with tobacco, it goes back to the history and this country's history with tobacco. Without going into too much detail, and there's also a training that we provide on the history of tobacco in African Americans and menthol that really discusses some of this. This country was really built on tobacco money, and the tobacco industry is really, dug in deep. And somebody else mentioned that it's all about the money. And when it comes to big tobacco, it's all about the money. So getting big tobacco off of the hill, not being able to lobby, that would be awesome. And I think that if that happened, we would see a huge improvement in tobacco related deaths and illness, because they wouldn't be able to dig their claws so deep into society. Question is, who do we lobby these issues to? Mayors, senators, governors. One thing, I think the education starts in the community. You've got to get the community support. You've got to get the community educated about the topic and why it's important, before you can take it, to the next level. But at the same time, who and how, definitely community leaders, definitely youth groups, and then, have the youth groups, have the community leaders present at board meetings, city council meetings, because you really need that community support, because if the community wants it, elected officials are really going to have no choice but to support it. Someone asked for a ballpark cost on our online trainings, and that's a loaded question, because some of the trainings are going to be free, some of them will have a cost, and we don't have that parsed out yet. For the most part, community organizations will probably be able to get these services at no charge. Specifically, our tobacco trainings, but there's going to be a plethora of trainings in our online university, which will be up and running probably in the next couple of weeks. If you check back, we'll eventually have it, listed out, and how much for each organization or an individual or a church. The costs are going to be affordable, and again, a lot of them are going to be offered free of charge. So it's going to depend on whether it's a day-long training, whether it's a series of trainings. But again, we don't want cost to be a factor either. So if an organization is looking for a training and cost is an issue, we can always talk about it and work something out to be able to provide that that training for whoever wants it and needs it. And I'm looking back through the Q&A. I think I touched on everything. If there were anything I missed, please feel free to go ahead and re-enter that. I'm going to scroll up and see if I can see anything that I missed. And go back and go into the chat. Yeah, there's some good comments there in the chat box. Go back to the Q&A. And I'm not sure if we can do this, but if folks can be taken off of mute and just jump in and ask some questions, that's fine as well. And then when we back to the question about menthol use rates, I think we kind of focused on African Americans are using it at almost 90%. But when we look at other populations, other folks are using it just as much, if not at the same level as African Americans. We know that Puerto Rican folks use menthol at very close levels. 80-90% of Puerto Rican smokers. Asian smokers smoke more menthol. LGBT smokers smoke more menthol. So we definitely see menthol use at a higher rate in lots of communities that are already, have other challenges, have other health challenges, have other social justice challenges. So adding menthol on top of it is just, another thing to worry about. And it's interesting that we see that use of menthol in these populations that are already suffering from disproportionate health, disproportionate incomes, disproportionate everything, but they're all using increased levels of menthol cigarettes. So another thing, definitely a social justice issue. How can we find the current toolkit? So the current toolkit, and I'm assuming you mean for No Menthol Sunday, is not up yet. It will be up soon. We are, in the planning process for No Menthol Sunday, which will be May 16th of this year. Again, let me go ahead and put my email in the chat. If you have any questions about trainings, about participating in No Menthol Sunday, or just any clarifications regarding the presentation, I'd be happy to discuss those with you. And I'm going to put my email in the chat right now. Okay, so there's another question. What other health risks are inherent to nicotine flavoring that are not present with unflavored tobacco? And I think you meant with menthol flavoring. So again, the menthol flavoring, like the person mentioned in Steve in this comment, it allows for it soothes it. It allows to take in more nicotine, which are really those are the big ones. Because of and because menthol, it has a slightly healthy connotation, and that's how they were advertised early on as, they were actually prescribed to patients, asthma patients, folks with respiratory issues, because menthol does, help with opening things up. But again, once those things are opened up and you can breathe more, now you can breathe more toxins. One of my colleagues, Dr. Phil Gardner, one of the phrases that he's coined and that I use all the time, menthol, it's an ingredient that helps the poison go down easier. And that's exactly pretty much what it does. And that's what it is. It's a poison. And I know we're close to running out of time. So going back to the Q&A slide or section, I don't see any new questions. Jumping back to the chat. Ikra mentioned not forgetting to do the session evaluation. And I will go back to the Q&A. Still no new questions. But actually, I got one more thing to discuss really quickly as far as menthol and the FDA. After this presentation was created, just earlier, was it earlier this week, late last week, the Attorney General of North Carolina actually wrote a letter to the FDA in support of banning menthol, and 20-something other AGs, Attorney Generals, signed on in support of that letter. Now, that's a big step to see Attorney Generals taking the stand and saying that, yes, menthol needs to be taken off the market, with the major points being that they know that taking menthol off the market will benefit public health in general, all populations. It'll decrease youth smoking and youth initiation, and it'll help mitigate harms to communities of color. So as we mentioned, communities of color are smoking menthols more. So to mitigate that harm that it's causing is important. And it's really important to see that support, knowing that some of these states are under preemption, and it'll be a whole process to even ban menthol. But if it's coming down from the local as opposed to from the federal as opposed to local, things can move a little quicker. So we're really excited to see where this AG support, where that's going to go. So again, we're seeing a lot more support for these menthol and flavor bans. All right. Glad to see this. Some people are fired up. I'm glad that this was beneficial. Again, and please feel free to reach out for some more in-depth trainings, and to participate in No Menthol Sunday, or just in general. Check out our website. We have our State of Black Health Conference coming up next month, actually, where we'll be discussing everything to do with social justice and health in the African American community. So feel free to register. Registration is open for another 4 weeks. It's open until the day of the conference, and registration is $75. So we're looking forward to that. If folks are interested in attending, please see our website. And again, my email is here. Please feel free to reach out. And thank you, Ikra. And if there's anything else, I'll be happy to, take your emails or take your phone calls. Great, thank you. You're welcome, Maggie. And thank you all for attending. And I'm not sure how this is going to. So Ikra, do I need to end it, or will this cut off by itself? Yes, you're welcome. You're welcome. Awesome. I'm glad folks enjoyed the presentation. Okay. And I will now be ending the session. Again, my email's out there. Please feel free to get in touch. And enjoy the rest of the conference. Thank you.